Welcome to our last speaker of the night. We are so excited to wrap up our second day of Parent Shower Week by having on with us. She will be joining us. Our team has been working with Dr. Diane all day to get her to come on live with us. She is our resident chiropractic expert and she sits on our Healing Mama panel of healthcare and wellness experts. And we're excited to have her join us. Now, we are going to give her a second to let everyone know that we are going on live. So I'm just going to sneak peek a little bit and let you know that you will be able to find Dr. Diane's write-up in the Healing Mama guide. So her original write-up is found here with incredibly useful tips, hacks, how-tos, and all the things that you need to know to be able to support your labor, delivery, and postpartum care. All right, so we have Dr. Diane that is going to be joining us any second. She's coming on. She's coming on! We made it happen! Yay!
I am so tech savvy now.
You have learned so much in the last 24 hours. I bet your daughters are impressed.
Well, I'm impressed with them. Yeah.
Exactly. Thank you for making this work and joining us for Parent Shower Week. What better way to start off 2021 than showering parents and all the things that they're going through?
Absolutely. It's a tough time to think about an upcoming pregnancy or a birth, or even if you have a lot of little ones right now. So something joyous and happy is what we all need.
Yes, exactly. And we're doing it party style. We've got balloons, we've got lots of music, and all that great stuff. This one is actually a baby shower one. We're going to have to come up with our own parent shower balloons. I think we're going to have to create it ourselves because everything is baby focused. So we're going to focus on parents as the new conversation. So thank you for joining us tonight and for making all of this happen. This was one of those, the universe just brings all the people who need to come together for Parent Shower Week and makes it happen in really fast time.
It did. But you were an amazing orchestrator, so it wouldn't have happened without you.
Thank you. And I also want to credit our team for just like, okay, guys, go do this, forward this, send this to everyone, and then everyone just coordinate with each other and then make it happen. And then I'm just going to show up on Instagram Live and hope that it all works out great. Awesome. So I want to dive in to your work as a chiropractor and what you've seen over the years. But first, give us your origin story. How did you even get into the world of chiropractic care, and then also the care around pre and postnatal care? So let's start with you and your story, Diane.
Sure. So I knew from a very young age that I wanted to get into some type of healing profession. At the time, I thought it was going to be medicine. And, I was the kid with the little, you might not know these, but you used to be able to buy little red plastic doctor bags, and it had like a little stethoscope there and all that stuff. So like that was my friend from the time I was about 3 or 4. So it just kind of seemed to be a path that was, I think, really chosen for me. And so I thought all throughout my teenage years that meant medicine. And I had an experience that left me a little bit disenchanted with the medical world.
Right.
I just couldn't envision myself just writing prescriptions and not like there wasn't anything else to offer, because that's kind of what I was receiving. And it wasn't really helping me. And, I wasn't a real drug person. So I sort of found my way through chiropractic with a referral from a friend of my mother's after I was struggling with these headaches. So I had headaches for
Wow.
months on end, same every day, and
Yeah.
it just wasn't getting anywhere medically. And so we went to see a chiropractor, and I didn't really get it because in my mind, I didn't have a back problem. I had a headache, and I didn't understand the connection between the spine, the nervous system, and what's going on with the body. Anyway, so within a couple of adjustments, I had no headache, and it was like a light bulb went off. You can
Yes.
heal without giving drugs and medication, actually working with the internal innate mechanisms that the body already has. So that just fell right in line with my philosophy. And so high school, university, chiropractic school, and then I did 3 years pre and postnatal specialty. So, and that's really because I have always had a real love of babies. I was the baby magnet. If there's a baby in the room, it's going to be in my arms within minutes.
Exactly.
The way it is. So that was my chiropractic story to begin with. I've since been in practice now for 26 years. It'll be 27 years this year. And
Congratulations.
yeah, thank you. It's crazy to talk about those numbers and actually speak them, but yeah, and it's just been such a blessed journey. I'm now taking care of sort of the fourth generation of people in the practice. So the moms that I was taking care of and the grandmas, and now those kids are having kids, they're having kids. So it's really neat to be able to see so many different generations, and yeah,
Amazing.
big family.
I'm gonna tap into that experience because I mean there are moms like me, brand new. I still consider myself a brand new mom in the newest generation of moms. And then what has been the most fascinating part about the work that we do at Healing Mama Co is learning the difference in care that has either gone up or gone down from a few years ago, a decade ago, a couple of decades ago, compared to where we are today. And so when you first started your practice over 20 years ago, what did prenatal and postpartum care look like?
So you didn't have a lot of choices. You went with a traditional medical obstetrical route, um, or you went with midwives. And midwifery at that time was not very widely understood or recognized. They just kind of
Right.
began to get their regulations. So to have a midwife, like, you were really granola if you were going to have a midwife. Like, that because all my children, I have 4 children, and all of them were born at home with a midwife. And for
Wow.
my
Congratulations. Good job, mama. 4 times.
awesome experiences all the way around. But in those days, people would really, be giving you the, oh, you're having your baby in the woods kind of scenario if you're having a midwife, and oh, the danger I was putting things in. So there's a lot of fear around birth and sort of natural or alternative birth choices. So
Exactly.
yeah, so that's really come around quite a bit now. Midwifery is, of course, quite accepted as a really viable option for moms to take. So that's been a really great thing. And we've had a lot of other regulated health professions and other professions kind of come up over the last 20 years. When I started in chiropractic, we didn't have really naturopaths. So,
Mm-hmm.
my role was multifaceted in that I was acting as a doula, I was acting as a naturopath, I was acting as a nutritionist. I was doing all these things to help people because there just weren't individuals specialized in those things. It's amazing now the teams that we have and the great resources that everybody can use. So it's it's really it allows women to really think about what their choices are, what the experience they want to have, and then they can pick the people to best support that. So
Exactly.
lots of choice. It's an amazing time to be pregnant.
It it really is. And you know, the whole reason that we created the Healing Mama panel of healthcare and wellness experts was so that we could showcase and expose new and expectant parents to all of their choices. There's this underlying conversation that happens in parenthood where it's like, I'm just gonna take it. I'm just this discomfort or this pain or this event or this experience I'm going through is just, it's a part of parenthood, so I'm just going to take it, when it's not. And there are people who specialize in so many areas that can support you so that that discomfort or that pain or that I'll just take it experience does not have to be a part of your parenting journey.
Yes.
And
Yes.
Dr. Diane is our resident chiropractic expert on our Healing Mama panel of healthcare and wellness experts. So I mentioned this earlier before you came on. So in our Healing Mama guide, you will find Dr. Diane's original write-up that you will have at your fingertips. So while you're going through preparing for childbirth, during childbirth, and postpartum, this Healing Mama guide is your, what we're calling the encyclopedia to childbirth and postpartum care. And earlier, before you came on, I was doing a live about navigating the Healing Mama home, and I was listing off all of the practitioners that we work with. And I'm even surprised at what we were able to grow in the last 9 months. We have
9 months.
In 9 months, right? In 9 months, we're just about to pop. Yeah. We are able to bring together over 15 experts in different fields around pre and postnatal care. So yes, when you talk about you having to wear all the hats decades ago and now being able to delegate those hats to different people, you can now focus on your areas of expertise. Now, when people were having, so this is something I wanted to ask in terms of before, did people talk about chiropractic care for prenatal support while you're still pregnant? Was that something that was a normal conversation that you noticed?
It was not as common as it is now. You know, the resources and the internet and the information age has really been able to reach a lot of people who wouldn't normally have access to, you know, those resources to discover different options. So there were a lot of it was kind of like a quiet whisper of people that knew about it.
Hey, did you know you can go see Dr. Diane?
It was a little bit kind of a quiet group of people that would understand or know that. But, you know, the profession and an organization called the International Chiropractic Pediatric Association, where I got my diplomat from, has been really outstanding and be able to get the message out that there are people that can help you prepare your body for birth. People that can help you with a baby that is in a breech position. There's people that can help you. You know, I hear a lot still with moms, I'll hear a lot of the dialogue being, oh, I just have pain. It's just that normal pregnancy pain. And
yeah, normal.
Yeah. So
we put that in front of words like it's okay.
Yeah. You know, and it's a common experience, but to say that it's normal, you know, pregnancy isn't supposed to be a painful process. So, yeah, so it's nice to be able to have a lot more educated women coming into the practice who have a chance to learn already about what chiropractic is and are excited to embark on that journey.
So, until how long into pregnancy can someone continue to see a chiropractor?
Right up until you kind of have to get out of the way for the baby to be born.
That's fantastic.
I've
40 weeks.
I've attended a lot of hospital births. I've attended a lot of home births because I will get sometimes that phone call from the midwife or the doula saying, you know, mom's not progressing. She doesn't want to go to the hospital, or, you know, she really doesn't want that epidural, or we're talking about maybe other interventions like a C-section. Could you come and just have a look? And, you know, without failed. None of the moms that I went into any of those situations with required any further intervention. All of their babies were born the way that they were hoping to. So,
Wow.
and
So
I get to be present at a birth too, which is, just
that's
awesome.
that's a privilege all on its own, for
Uh,
sure.
yeah.
So can you share a bit more about what that looks like? So having a chiropractor to support babies to come through the canal. So what it sounds like is these moms are basically either stuck at a dilation, they haven't moved, and they need some push to get the baby to start coming, and for them to start dilating further. Is that the case that you've been invited into these rooms?
So first, I have to say, in terms of the hospital setting, it's a very much on the QT kind of situation because I'm not supposed to be caring for moms in the hospital. But most of the time, and chiropractic, you have to think about it working in really two aspects when it comes to the birth situation. One is we're talking about just alignment. So
Yeah.
the joints, the pelvis, the sacrum, all of those things have to open and move in order for the baby to be able to descend properly. So if things get stuck, that can be tremendous pressure and can create quite a bit of pain in labor when things aren't moving the way they should. And the other aspect is neurologically, what we're really working with in terms of chiropractic is we want to make sure that there's clear open communication from the brain down through the spinal system into
Right.
the uterus, the cervix, the pelvic floor. All of those things have to be talking in a coordinated, productive, controlled way. And when those things aren't communicating clearly, things don't move along. So sometimes I have to do very little. Sometimes there's a lot, particularly if there's been a situation where maybe mom's had quite a bit already going on with the alignment in her pelvis, and the timing's just off in terms of when the baby's coming. Things
Right.
hadn't corrected yet. So yeah, so that's really what we're looking at when we take
Got
care.
it.
So in that stage, when we're taking care of women who are right into that sort of
The laboring.
the labor, it's usually very slow process. It's very quiet. We have to try to get mom in between contractions. Mom has to be able to get in a position for me to help her, which isn't always so easy. So
Exactly.
lots of pillows and just taking things slowly and going between contractions, and yeah, and then just sort of listening to the mom's cues as to what we need to do.
Got it. Yeah, that's extremely important. Making sure that the channels of communication internally don't have a roadblock. So it sounds like you're able to remove that roadblock so that the communication flows, that the brain to the body and all of the systems that are getting this human to come out of you are actually coordinating. Oh my goodness.
Yes.
Yes, I completely understand it. My birth experience was very much an out of body experience. I can see myself going through labor and almost hearing what's happening in my body, because I just basically told my mind to shut up. Okay.
Yeah.
And let the body's intelligence do the work, because I had no idea what I was doing.
Absolutely. Yes. We're hardwired to be able to do that, provided you can get out of the way, right? Mentally, we have to get out of the way and just let the wisdom of our being do what it's meant to do.
Exactly. 100%. There was a point where, we both had home births, and I don't know if this happens. You can tell me if this happens for many women. I had no urge to be on the bed, to lie down. No part of my being wanted to be on the bed. And I'd look over at it and like, oh, it looks so comfortable. And every time I attempted, is like, nope, sit back down. And I just had the baby in a squat position. It's like, man, the bed it's right there. Like literally, I could put my hand on the bed. That's how close it was. So do you find that happens in labor, where you don't have that experience of wanting the pillows and finding that comfortable rest position? Is
When
that
I have witnessed women giving birth in all kinds of wild and crazy positions and situations that in no way would you ever think that would be or look comfortable any other time. And it's again listening to that inner wisdom, which is being birthed as the baby is, right? That mama wisdom of
Hmm.
really listening to what is your body need you to do. Maybe it's on all fours. Maybe it's, holding a rebozo strap and leaning against something. Maybe it's standing,
Yeah.
um, squatting. I mean, all different kinds of
So
scenarios. So
exactly. Now, can we talk about the postpartum phase, and what is the earliest that you've been able to start seeing a new mom?
so again, there's no delineation of when we have to stop in any way. So
Right.
I've taken care of women, within like 20 minutes of having a baby.
Wow.
Um, it is, once the placenta has been delivered and everything's looking okay, then if if mom asks, I would be very happy to just do a check and make sure that everything through that process is okay and mom is able to recover better. So, but I would say on average, women are typically coming in about a week or two after the baby's born.
Wow.
Um, in instances where there's been a belly birth, then I
Mhm.
might go and see a mom at home. And, if they're not able to be mobile, sometimes they need a house visit.
Mhm.
So yeah, it's really as soon as they feel ready to have some self-care happen.
Okay. And with COVID, have you found, has there been a change? Have you been able to adjust how you're able to care for the new mamas during what's happening right now?
It's certainly we're not attending any births right now, and uh, I would say that aside from all of the protective measures that we have to do, at this stage right now, we're able to be open and caring for all individuals. Back in March, it was emergencies only. So, you had to be in a real state to be able to get adjusted, be seen now at that point. But now it's much more open, and anyone is able to requires assistance is able to get it.
Okay. Okay, that's perfect. That's actually really useful to know and how people are navigating through it. Can you share about chiropractic care on infants, and what are the signs that parents can look for in their new baby that might be a sign that maybe a chiropractor might be able to help with these signs, symptoms, and experiences that they're having, that their baby is having?
Sure. So even without looking at anything specific with the baby, if mom had a breech presentation at any time, that's a little bit of a yellow flag that the baby should be checked because of the way that the pressures take place on the baby. Um,
Okay.
Intervention used in terms of forceps, vacuum, or any physical pulling or pushing on the baby, that's a definite should have some assessments done there.
Okay.
So aside from that, if the birth didn't seem to have any of those aspects to it, then things like difficulty with nursing, if that latch isn't happening, sometimes there's a communication breakdown somewhere. You have to remember that the hardest thing when the baby's born, that the part of the baby's body that takes the most pressure is the neck, right? Is that
Right.
occipital cervical junction right here. And if it's been a really long, prolonged labor, that can really jam things up right away. Some of the
Right.
statistics are showing that over 85% of babies born in obstetrical births have some type of issue in the cervical area. So those are
Wow.
really high numbers.
Yes.
So things that you can kind of look for are things like the breastfeeding, things
Yeah.
like always having a head tilt to one particular side. So when
Mm,
car seat, are they always really leaning to one side? Or are they turning always to one side? Do they prefer
yeah.
nursing one breast over another breast? because that could be uncomfortable for them to turn into, right?
Right.
Are
Exactly.
are are they inconsolable or really crying a lot? Is there some, and moms sometimes know this very instinctively, my baby looks like they're in pain. They've been
Right.
fed, been changed, everything's fine, but there's something not right. So digestive issues, constipation, um,
Mm.
those are the main signs.
So I want to touch on constipation because this actually happens quite often, that we have got feedback from many new parents now, that their baby will go regularly every 2 to 3 days, and that's just the way that it is, and they think that that's fine. I don't know if that's okay into toddlerhood, that it's still every 2 to 3 days versus at least once a day going and having a stool. And so can chiropractic care help have your digestion, your baby's or toddler's digestion, be more regular?
Absolutely. That's actually the topic that I happen to have written a research paper on. And again, it's all about that communication. You have a few areas in the spinal system, in that spinal pathway, that regulate bowel function. And if there's some type of shift happening in those areas, it can impact bowel function quite readily. So it's chiropractic isn't necessarily, if you have constipation, chiropractic will help. It can help if we have a problem that's there that we can
Yeah.
to restore. So it's not a treatment for constipation per se, but people who have had constipation, we can find these blocks in communication,
Exactly.
tremendous results. So on average, I would say that somewhere around 90% of the infants that I've seen, or children, have had tremendous results with bowel function. And that's just normalizing those normal body pathways and systems. And by
And have,
recently seen a mom whose baby, as this was my longest, and it just happened the last month, 21 days, 21 days, and happy, not complaining,
so
not
no signs.
and she's had medical advice as well, but yeah. Anyway, she's down to, I think she's doing a good bowel movement every 2 days now, but 21 days.
21
That
days. Oh my goodness. That has to be a record somewhere.
I've never heard of that. I have to look at some of the research and see what the absolute tallest or highest number is, but it's got to be up there.
That's got to be up there for a child. Yes. Oh my goodness. 21 days. Well, there you go. There are more than than you can count benefits of having chiropractic care with infants. Now, I want to just confirm, what is the earliest age that an infant can receive chiropractic care?
Hours.
Amazing.
within
Amazing.
within hours. It's just as soon as mom is comfortable, everyone is doing okay after birth, and then as soon as they're comfortable to start getting some care, we're ready for them.
Amazing. Okay. And can we talk about colic, and can
Sure.
chiropractic care help alleviate colicky babies?
Chiropractic can definitely help with the symptoms of colic for a majority of infants. Again, if we find there's a distortion, there is a disconnection somewhere, and we restore,
Mm-hmm.
it allows, just like we have to sort of step away and allow birth to happen through us, if we
Yeah.
can those blockages on an infant, their systems can just start to regulate normally. So things like the constipation, things like being able to nurse properly or breathe properly, or
All of a sudden happen. Let's see if Dr. Diane will come back so we can infant. Dr. Diane is going to come back any second now. We apologize. We sincerely apologize for the technical glitch. We're going to get Dr. Diane back on any minute now. any minute now. Let's give it a couple more seconds. Dr. Diane is going to come back and we're going to get this conversation continued. We hope everyone is enjoying their evening with us and talking all about the amazing benefits of chiropractic care. We talked about chiropractic care prenatally. We talked about chiropractic care through labor. And that is something brand new that I'm learning today with you as well. And then within hours, it is possible for an infant to also receive chiropractic care. And for the birthing person, you can have chiropractic care within hours as well into birth. So let's hope that Dr. Diane will join us again. Yes. All right. Dr. Diane has rejoined us. Oh my goodness. We're going to come back on any second now. All right.
Oh, we're back.
We are back. Oh, technical glitches. Wonderful. Okay.
Things just froze and I didn't know if you could still hear me or whether or not I sort of shut down. So
yeah, it's, you know what, same here. Everything just off. I think Instagram is giving us a sign. And I was like, no, Instagram, we're going to bring Diane back on and we're going to finish this conversation because we need to know about all of these things that we were just talking about. Okay, so where we last left off was talking about chiropractic care with infants. Was there any other issues that you have found that is the most common that come up for infants and children to come and see a chiropractor that we haven't talked about? So there's the latching, there is the pain, there is digestion, and
constipation.
Yes.
Odd movements or preferences of the head, preferential breastfeeding on one side, sometimes really bloated tummies that really are bulging quite a bit. So that really balloony kind of gassy tummy that's indicative of some issues with digestion. Sometimes it's not moving a limb the same way. You know, that one arm really moves, but the other arm doesn't move as much, or one. Sometimes you can see a real discrepancy in how the tone of one side of the body versus the other. So one leg might look a little bit shorter than the other.
Okay.
So moms can sometimes pick things like that up as well.
Got it.
But those are really the most common things. And sometimes we'll see infants with some head distortion, where you have a bit of a cone head that doesn't settle down, or the head can look a little bit flat on one side or bulging out on another.
Right.
And usually from some birth trauma there, if the baby was in the canal for a really long time or not lining up the proper way to be able to be born. So those are things that are most commonly the issues that I see.
Got it. Okay. Can we talk about family chiropractic care? Because there's chiropractic care for the birthing person, and just as important is the birthing partner, because they're most likely doing hopefully all the work while you're in bed resting, bonding with baby and doing that. So ideally, you know, they're the ones doing all the cooking, cleaning, organizing, handling everything else while you are in bed. Mama, be in bed. Please be in bed.
Yes. Yeah. So, you know, one of the things that we haven't really talked about is that we're talking about all kinds of different conditions and things that people experience and often will seek care for, but you really don't need to have a symptom or a problem that you're aware of in order to be able to benefit from chiropractic. Again, it's all about that connection, that allowing the brain to be able to clearly communicate to every cell, tissue, and organ in the body, and those structures being able to send information back up again. If you have open channels that way, you are functioning at your optimal, and you know nothing's going to stop you. But you know, we don't often roughly the research is showing maybe 10% of the time we have an awareness that there's something wrong. So that means 90% of the time we don't have any symptoms or any pain or any signals to say, hey, there's something really off. So we don't know that there's anything going on. So
Exactly.
our mom support people, you know, they're going to be pulling usually double and triple duty.
Yeah, so quadruple sometimes.
Yeah, sometimes quadruple, and they need self-care too. You know,
Yes.
how things come out of alignment in the body is really all about stress. Different forms of stress, your physical stress, your mental, emotional stress, toxic stress, all of these things can build up and sometimes really create these misalignments in our systems. And sometimes we can let them go on our own, which is awesome.
Yeah.
Sometimes they can sit and really become a problem for us. So it's always great to just get checked, make sure that your body is handling all of those new stressors really,
Yeah.
that you're thriving too. Because mama needs you to be working well.
Yes, please, because it's crucial to all of our well-being that there's someone here to feed us and bring us the things that we need so we can care for ourselves and
Absolutely.
also care for baby. So yes, partner, please go get support. You don't need to be in pain to go and seek out the care that a chiropractor provides. My husband and I see a chiropractor. We just saw a chiropractor actually yesterday. And
Ah,
fortunately, they're like within 7-minute walking distance from us. So it works out really great. And
perfect.
we've been seeing a chiropractor since 2011. And it only happened because I had, that I learned eventually from the chiropractor we saw that I had sciatica in my right side. And I was limping. I just let myself limp and think it's going to go away. I limped for 2 weeks. And one of my colleagues in my previous life was like, okay, Rowena, you keep limping. Like, what's happening with you? And he basically said, go see my brother-in-law. He's a chiropractor. He lives close to your place. Go see him. Within one visit, I wasn't limping. And I didn't realize that if I didn't go see someone, I would have either had drugs to take or this would have been a long-term uh, problem for
Yeah,
me.
could have
So
gotten a lot worse.
yes, exactly. So good on people who are annoyed by my limping that
Yes,
it's not normal to
pains,
be in
it's
pain.
not normal. And sometimes, you know, we go through times where we're so used to dealing with a certain signal or symptom or pain that it's just become a sort of a part of our life. It's become a part of our experience. And it's
Mhm.
not until you sort of get it taken away from you for a minute that you're like, oh my gosh, now I remember what it's supposed to feel like. You know,
Yes.
that just became part of my normal everyday experience. So yeah, I mean, with 2 weeks you were probably still grumbling about it a little bit, but you know, sometimes I see individuals who have been struggling with a problem for years,
Wow.
and you know, you have kind of given up on things and it's just become part of their experience. I had a lady in today who, you know, she's had a headache every day for the last 6 years,
Oh
and
gosh.
you know, different degrees of it, but yeah, how exciting. She's taking some cool steps to what that's going to mean for her and
Yeah,
her family.
exactly. Because chronic pain, there is a solution for it. You just have to be open to finding it and working with the specialists and the doctors who are here to give you more than just a prescription.
Absolutely. Don't give up. There's always another option.
Exactly. And so I want you to share with us any other blind spots that occur that we haven't talked about already when it comes to new parenthood that your work is a direct solution for.
Um, I think really we've covered so many different aspects, and I hope through our discussion, our viewers will be able to understand that it doesn't really matter if you have a symptom or a pain or not. If whatever your experience is, if you're sort of physically, if you're feeling like there's something not quite right,
Mm-hmm.
then that's an opportunity to have an assessment and see if there's something we can do to help. And
Perfect.
not something within my level of expertise. We have an amazing team of fabulous support people that I can refer to. So just take that step to get some answers.
Perfect. And Dr. Diane, if can you share the giveaway that you have so graciously offered? So she has, again, this is if you're in her area. So I'm going to let her explain what her region is, and if you're in the area, then please apply for this giveaway. So it is, and I'm going to say it exactly how you wrote it to us. So it's a complimentary first visit. So it includes a consultation, a neural exam, a computerized scanning. So I'm going to let you explain that, and report for the pregnant mama or baby. So tell
Yeah.
us a little bit more about what all of that means, because I don't know what a neural examination is or a computerized scanning is.
Okay, so part of a chiropractic assessment involves looking at what's going on with your nervous system. So we do a thorough evaluation about that. And one of the tools that I use is called an insight subluxation station. So it's a scanning system that just picks up information. It's not like an ultrasound that's sending things into the body. It's just picking up information. So it's completely safe for moms, for anyone. And it gives us information about the impact of any of the misalignments that we might find are having. So we're looking for a specific kind of misalignment that's called a subluxation, and it's that basically means there's interference with the nervous system, and we're looking to see what the impact of that is. So where is it impacting the body? To what degree is it impacting the body? What systems could it be affecting? And how easy is it for that individual to handle the everyday stresses right now? So we can, if somebody is really frazzled and not coping well with what's going on in their world, and that's a different set of recommendations and criteria care than someone who is thriving. What's going on in their environment isn't really impacting them. They're letting it sort of wash over and out of themselves. There'll be a different set of recommendations for an individual like that. So it really helps me to see beyond just what an individual is feeling or experiencing. I can kind of get a window into what's going on neurologically. So for anybody who's near me in Oakville, I'm in downtown Oakville area. I have a second practice in Milton at the Womb. So if you're either in Oakville or in Milton, it would be an easy trip for you to come and see me. And so this is for a mom who is interested. You could be pregnant, thinking about getting pregnant and wanting to make sure that everything is connected well. If you're working through some fertility issues, or you could be post-expecting, or if you just had the baby, or if your heart calls you to have the baby checked, this offer goes for the baby examination as well.
Perfect. Amazing. So we're excited to post about this giveaway. So be sure to enter the how-to in our separate giveaway post. So we will be posting that very soon of all the ways that you can enter. And again, this is open to ideally if you're in the Milton, Oakville area in Ontario, Canada, this prize package is for you or your baby or your partner. You could also enter for your partner as well. So there's so many applications and people who this giveaway can go to. So Diane, thank you so much for your time. I'm going to ask you one last question. So of all the offerings that Healing Mama Co has, our systems, our bundles, our products, and everything, is there a favorite that you have that Healing Mama Co provides?
A favorite? That's a tough one.
Or that you like.
I wish this was around when I had my babies, because holy smokes, would it have been a blessing. I mean, they're all fantastic. I think, you know, I've had opportunity to really get close and personal with the labor and postpartum package. It's
yes.
we've had such a blast unpacking that and looking at it and seeing all the amazing things that are in there. And it's one of those things that it never ends. You keep opening up new envelopes and zippers, and there's more stuff in there. I mean, there isn't anything you haven't thought of. So that's incredible. Some of the postpartum packages too are fantastic. All of the things in there that will help with breastfeeding and all the issues that can happen with thing, and also with the genital area care is amazing. So I don't know if I could say that I have a favorite. I think they're all incredible. You just have to really look at them and see which one I think draws you in. I think actually probably, you know, you're great to have the labor care package, and then the postpartum package would be just what a great combo.
Yeah, you're set. Oh, thank you. So I can't stop smiling. This is amazing. Thank you so much, Diane.
Oh, and you know what? Thank you for taking the time and the initiative to put this together and to put this team together. I feel very blessed to be part of the process, and so excited to see this blossom and grow.
Amazing. We love having you a part of the family, and we honestly could not do the work that we do without the backing of professionals and healthcare practitioners like yourself, to understand that what we do is more than just a pretty gift bag, or then another pretty box that a mom should have. This is a real practical application that has real world benefits and uses, and that you get all the pretty stuff with it too. So you get a little bit of both.
Yes, it's a beautiful system.
Thank you so much, Diane. Can you let everyone know the ways that they can communicate with you if anyone has any questions, or potentially is in the area and wants to come in and see you as well?
The easiest way to connect with us would be just to go to the website, drdianemeyer.com, and there's a variety of different options there for people to be able to reach. So with email or phone or on Facebook, you can connect with us.
Perfect. Thank you again, Diane. Have a wonderful rest of your Tuesday, and 2021 is going to be the most impactful.
Absolutely. Baby showers everywhere.
Exactly. Thank you so much. Have a
You're
great
welcome.
evening.
You too.
Bye.
Bye-bye.